Our title of this session is a youth health argument for intergenerational climate justice. And this object is about the diverse youth experts in the climate and health environment, focuses on the intersection between youth, climate, and health. So we will be exploring the complex pathways through which climate change impacts health directly and indirectly, especially for young people. Holding understanding of the different contexts of the oppression that marginalized people face, panelists will then share best practices and demonstrate concrete solutions that young people are leading to adapt and mitigate to the harms of climate change on people's health, including systemic solutions that impact health outcomes such as the Global Green New Deal and Fossil Fuel Non-Proliferation Treaty. So we will talk about the following objectives: raise awareness amongst youth people beyond the health sector of the impacts of climate change on health and the need to adopt a health argument for climate action. Second, explore how youth-led, system-focused climate actions are also health interventions with socioeconomic health co-benefits. Third, increase recognition of the co-benefits as not only additional support, but as the key opportunities for achieving health justice. And finally, facilitate collaboration on intersectoral collective action and strengthen solidarity between various youth climate movements. And the next will be the video recording from Singh, who unfortunately will not be here, and he will be giving a short introduction on the topic of the event, the intersection between youth, climate, and health. A video, please.
The recent floods in Pakistan have affected many people's physical health, physical trauma. It's caused displacement, it's caused mental health impact as well, especially linked to things such as PTSD, or exploring things such as nostalgia, a term coined to describe existential dread in relation to climate change. Exploring indirect impacts, however, Ecuador, for example, has faced many oil spills. The impact of this is brutal. We can look at how the access to land is reduced due to oil spill. We can look at how food access is reduced as a result of agriculture being impacted. We can also look at how access to medicine is being impacted. For example, plants that are grown to use for medicine are no longer accessible in those regions. It is clear that climate change and health are truly interrelated. What's vital to remember, however, is that this is not an even spread. Marginalized people across the globe are facing the biggest threats of all. We've seen that in Pakistan, we've seen that in Ecuador, even in London, we see that through people who are from lower middle socioeconomic backgrounds are affected worst. Young people, however, have mobilized for climate action. They've joined the streets, but they've also joined negotiation rooms. They've begun writing policies and writing legislations, lobbying parliamentarians. So it is clear that young people are leading the way in mitigating this crisis, using an imaginary lens, a lens that moves beyond current structures of the world and towards a more just world. The climate actions that young people are calling for would not only stop the climate crisis, they would produce benefits as well. For example, providing more cycling lanes and walking access would increase benefits through the form of physical health. People would be walking more often. More so than just this, they're calling for reparations. They're calling for a justice-focused lens towards climate action. This includes loss and damage and financial recompensation for countries that have been worst affected, but it also includes things like access to land, access to clean water, and importantly, access to strong healthcare systems. All of these calls to actions will improve the health of the wider community. They will increase community health, they will increase spiritual health, alongside the mental, physical, and social health that we've already talked about. This is why the health community stands as a pillar for the wider climate justice movement. This is why the youth movement stands as a pillar for the wider climate justice movement. And this is why it is incredibly important to take on the perspective of the youth, climate, and health movements.
This the panelist questions, and it will be about the complex pathways through which climate change impacts health directly and indirectly, especially for young people, including sub-themes such as air pollution, mental health, and adolescent health. And I would like to introduce each speaker, and they will introduce themselves.
So in terms of introduction, my name is Mohamed Eissa, and I'm the liaison officer for public health issues at the International Federation of Medical Student Associations.
Hi everyone, my name is Giulia. I'm project officer at the Partnership for Maternal, Newborn and Child Health, PMNCH.
Hi everyone, I'm Dr. Sri Hari Govind. I'm part of the youth constituency, the UNFCCC YOUNGO-Health working group. I'm its internal affairs officer.
Hi everyone, my name is Audrey and I'm a pharmacist based in the US, and I'm also currently the chairperson of public health of the International Pharmaceutical Students Federation.
Thank you. So next I will be asking Mohamed a question on, as a young medical student and a liaison officer for IFMSA, can you tell us why it is urgent that we address the health impacts of climate change? Why is the climate crisis a health crisis?
Yes, thank you so much for the question. So in terms of this, I believe, it's not I believe, but also the science has shown the different impacts of the climate change on the health, whether it's direct impacts or indirect impacts, whether it's just like people being affected by the extreme weather events, or people just dying even by floods, by droughts, etc., or people suffering from indirect impacts through the increase in the prevalence of foodborne, waterborne, and vector-borne and airborne diseases, just because of the change in the adaptation of the different structures to the climate crisis. And I was actually thinking about this yesterday, why would all these people be in COP? And specifically, and which is surprising also for me, why they're not speaking about health. Because for me, I guess everyone is here because they are feeling that they will die because of the climate change. So that's a health issue. So people know that it's a health issue, but they are not speaking that it's a health issue, and still they are not including health sufficiently on the agenda. And that's why when we speak about climate change, we're already seeing how many people are expected to die due to the climate crisis, and how even it's different, how the vulnerability is different between different groups, between different regions, between different countries. For example, since this COP is in Africa, how many of the countries in the African region are more vulnerable to the severe impacts of the climate change, and how it may impact its health as well. And that's also why many people and many countries are coming here calling for more work on the adaptation, more work on the mitigation, more work on loss and damage, all these areas, just because they are feeling the health impact of the climate change. So I just don't see valid reasoning for, I would say, I guess 30,000 people are attending COP this year. So there is no valid reasoning for 30,000 people to attend COP if they are not feeling death. And death is actually part of the health when we're speaking about health, which is physical, mental, and social well-being. So if you're dead, it's actually you don't have a physical well-being, that's it. So that's why the climate crisis is a health crisis, and that's why we need to urgently act on it, because the health impacts will continue and everyone will be affected. And for me, it would be something that's not logical at all for countries to think that just dealing with their own issues and having their own agendas and not speaking about health would save them, because at the end we have all seen how all countries got affected or are still getting affected by the climate crisis, and how everyone is getting affected also in terms of the health. Specifically, that also like the climate crisis not just affecting also health in terms of the different examples I give, but also affecting our social, economic, commercial, and other determinants of health, leading, for example, to displacements, leading to conflict, leading to disruption of economic systems. All these are even affecting our SDGs agenda. And if there is no health, then there are no other SDGs that we can focus on, whether the climate crisis or other SDGs as well. Thank you.
So thank you. It's really great that you mentioned that health is connected to everything, including SDGs, that we can all look from different perspectives. So the next question is to Harry. Building on what Mohamed just experienced, we know that the impact of climate change on people's health is not equal, but it is dependent on compounding vulnerable factors. Why are we already marginalized and vulnerable people most affected?
Okay, so I think everyone resonates with me when I say the people who are most affected by climate change are oftentimes the least responsible for it. So we have to start off by the fact that by 2030, around the carbon emissions by the 1% of the richest people in the world will be 30 times more than the 1.5 degrees Celsius target, which was negotiated at Paris. Health affects everyone differently. And when we are, compounded by multitudes of vulnerable factors, I think the health effects are exacerbated for certain individuals in certain communities, especially when they're vulnerable. The main vulnerability that I think at least would be economic inequality, which is the human costs of health, which arises from soil erosion, from bad water, food insecurity, water insecurity, biodiversity loss. Now, as we can see, we are having the loss and damage negotiations happening. I mean, not exactly negotiation, but we just got the concept of loss and damage accepted at this COP. Now, if you look at it, health is seen as a non-economic factor of loss and damage, but nobody talks about the economic side. The multiple and the triple or the quadruple burden of healthcare on communities because they tend to be in the affected areas and tend to be in communities which are vulnerable, which do not have the same access as the rest of us. So I was working with the WHO Collaborating Center for Non-Communicable Diseases in India, and we actually mapped out how non-communicable diseases affect the vulnerable communities. So what we found is certain factors like food insecurity, soil erosion, war and instability, oftentimes they tend to lead to human displacement, right? And these tend to exacerbate and then triple and quadruple the health burden on these communities. So if you ask me why, it's because the rich keep being rich and they destroy the barrier of access that these communities are able to, they destroy the barrier for the communities to not be able to access the basics of health services. The politicians don't, and we've been here at COP for 27 years and we still haven't been able to get the basic decent health services and sexual health and mental health services. So I think that is why the vulnerable communities are worse for wear.
Thank you for Harry for your inputs on how health affects vulnerable communities and its surrounding environment. So then the next question to Giulia is, amongst the most vulnerable to climate change are children, adolescents, and young people. Can you tell us more on why this is the case?
Thank you, Yoko. So Harry just talked about the different vulnerabilities of different population groups, and we all know that children, adolescents, and young people are the most disproportionately affected by climate change. Currently, the current generation of adolescents and young people is around 1.8 billion around the world, which represents nearly 24% of the global population. And studies from the WHO, UNICEF, and Lancet Commission show that currently there is no country in the world which has a sustainable environment for children and adolescents' healthy lives, both today and in the future. We know that the science shows that over their lifetimes, young people will suffer between 2 to 7-fold increase in extreme weather events, having devastating impacts on their current lives, but also future well-being. At PMNCH, we've recently launched the Adolescent Wellbeing BMJ collection. And as part of that collection, there is one evidence paper specifically looking at the impact of climate change on adolescents and young people's well-being. And so I would like to bring today some of the findings of this paper. So when we take into consideration the first domain of well-being, which is good health and nutrition, we know that, for example, climate change exacerbates pollen levels and creates longer pollen seasons due to the worsening air quality given the burning of fossil fuels, increasing thunderstorms and extreme weather events, which increase the risk of asthma attacks, which is one of the most common chronic diseases amongst adolescents and young people. We also know that climate change impacts nutrition, with effects on the physical and cognitive development of young people, and specifically adolescent girls are more likely to go hungry after extreme weather events. In addition, we know that climate change impacts on young people's post-traumatic stress disorder after extreme weather events. This can be a major cause of suicide, which is the third cause of death in adolescents between 15 to 19. In terms of the second domain, which is connectedness and contribution to society, we know how important it is for adolescents and young people to be connected with their society, and we've seen the devastating impacts of COVID-19 on this. Climate change affects adolescents and young people's relationship with their families and communities by increasing the chances of displacement and migration. And although we don't have exact disaggregated data on climate migration, we know that young people under the age of 18 are often the most affected by by displacement due to climate-related disasters. When we look at the third domain, which is safe and supportive environment, we know that climate change increases the risk of violence, both within and across countries. And specifically, it increases gender-based violence. Evidence shows that young girls are often forced into child marriage due to families trying to find the means to support their survival due to climate-related impacts, economic impacts specifically. When looking at the fourth domain, which is education and employment, we know that climate-related weather events cause often school closures. For example, in the United States, it's actually one of the main causes of school closures are extreme weather events. And we know, for example, that higher temperatures impact on young people's and also teachers' academic performance. And finally, the last domain, which is agency and resilience, we know that the psychological distress caused by climate change on young people is very high. In a recent survey of over 10,000 young people, we know that the majority of respondents have said that they feel very anxious, afraid, powerless, and scared about the climate crisis. And so it is really impacting as well on their resilience. So overall, this study basically shows that climate change really impacts on all the domains of adolescents and young people's well-being, and it has a disproportional impact on this population group. And therefore, this is why it's really important to put children, adolescents, and young people at the center of the climate responses in order to have more just climate action, given the profound intergenerational injustice that the climate crisis has. Thank you.
Thank you for your input to that question. And the last question for this part will be given to Audrey. Given the impact of climate change on health, especially that of young people, what are the health co-benefits of scaling up climate action and rapidly reducing our dependency on fossil fuels?
I really want to echo all of the other speakers who have said, I think that climate crisis is a health crisis. As a young pharmacist working in the front line myself, I do see a lot of patients coming into community pharmacy or clinics asking for medications like asthma medications or heat stroke medications. And we see that all of this can be prevented. And then as we see that this climate is really impacting the patients here as well. And it makes people ask that, oh, why are pharmacists doing here? But like one big thing that we want to talk about is supply chain. We can see that with the climate change, it actually impacts the supply chain. So when we think about in a pandemic, we come up with the COVID vaccine. So what is next? The next thing is about, oh, how do we store a COVID vaccine? It has to be stored in negative 80 degrees. Do we have the environment to store it? If we don't, then the next question is, oh, do we want to worry another thing in this pandemic? No, we don't, because this is something that we need to deal with it right now. So with that being said, other than the supply chain, you want to talk about access to medications. So for example, in the hospital, we have a lot of the medical equipments require electricity. What if we have a climate crisis and we have loss of electricity? So now all of the patients who require all these medical requirements or your medications will not have that. So some patients actually die because they do not have the equipment during all this climate crisis. So it's really important.
Thank you.
Hello. So we really want to focus it right now. So overall, what we really want is to make sure that all of people will have the access to medications. They deserve all of the health services. We really people are not gonna affect because of the climate change to have any issues that they're undertreated or there's any cases that there will be any toxic degradation of your active ingredients of your medications.
Thank you. And we will move to next session on these questions as well. So I will ask Harry. So moving on to looking at the youth-led climate action, can you give us some examples from your experience in India and Asia?
So I work with the Global Consortium of Climate and Health Education at Columbia University, and I'm a fellow for them, and I'm working with them and the Edward and Cynthia School of Public Health, and we're trying to create a climate health fellowship which brings together, which is more of a studentship than a fellowship. It brings together the healthcare community of India, and then we're trying to inculcate with them the climate health knowledge and also help them build resilience in the communities, not only have the knowledge for themselves, but also, in local solutions. That is one example I think is very apt for the question. One other thing that I did find when I was working in disaster risk reduction in Indonesia was, the local communities that they work there. They work with IFMSA and the Indonesian government, and they've actually been able to incorporate climate health in the community building resilience initiative, and that actually brought forth a lot of health co-benefits, which turned out to be very nice. I think I'll stop with this because otherwise the examples keep going on and on.
Thank you for your quick intervention. And next to Mohamed. Another example of how young people are leading in the intersection on climate health is really by creating partnerships in supporting the health climate movement, including in advocating for fossil fuel non-proliferation treaty. Can you tell me more about the fossil fuel non-proliferation treaty and how the work of the Youth and Climate Network in this regard?
Yes, thank you so much for the question. So I would say our biggest crisis of the climate crisis, the fossil fuels. So yeah, the fossil fuel non-proliferation treaty, it's a call, or like the health community and many of other like sectors as well are calling for this fossil fuel non-proliferation treaty. Even the WHO has endorsed it, even IFMSA, even the other health community as well, they are all supporting this. that we need to stop the fossil fuel proliferation. And the treaty itself that we're calling for it has three main pillars. The first thing is about the non-proliferation of new, I would say, or more fossil fuels, phasing out from the existing resources for the fossil fuels, and ensuring also a just transition from the fossil fuel industry that's happening. This is something that needs to stop, and I understand also that many, like I would say even on the bright side, that I can see parties that are even negotiating for that we need to cut down from fossil fuels, and I would say cut down is not the right language, which is the existing language at the moment. It should be cut out, which is something that we're still struggling with, that we want it to be cut out fossil fuels and not just cut down. Transferring to renewable energy, I understand also that many countries are very much dependent on fossil fuels. However, when we see the health impact of using the fossil fuels and their impact on the climate crisis and the impact on the health system, this would lead to more economic burden that would still affect the economy of these countries. So they would be raising their economies on one hand with the fossil fuel proliferation and decreasing or destroying their economy on the other hand with the health impact, with the climate crisis, and with the disruption in the economic system by the fossil fuels. So it's very much important to transfer to the renewable energies. And I would say, for example, I come from an Arab state, and I was even like doing researching or more reading more about what the Arab states is happening there, and I have like reached the point that like there is only 7% of the power in the whole Arab states that's coming from renewable energy. 7% is a very low number, very low percentage, and we need to work more on it. In terms of the work or the leading of the youth, what has been happening, GCHA, the Global Climate and Health Alliance, and we have our colleagues here from the Alliance, they have been leading on creating a network for the youth and working on climate change and health. And we already started, we have a founding committee, and some of my colleagues are present there, Giulia is here, and like many of us are here as well, that we're founding now the first network for youth, climate change and health in order to make sure that more action and more contributions to the climate change and to the climate action and how to tackle this crisis is done by the youth. So this is something definitely on our agendas once the network itself is founded, which is now we're in the state of founding the network itself. So this is definitely something on our agenda. This is definitely something that we will be focusing on, and definitely will be like calling for meaningful youth engagement in non-proliferation of all fossil fuels. Yeah, that's from my side.
Thank you. And the next question will be up to Audrey. Despite much work the young people are doing, we are often still not heard and do not have a seat at the table. How much is meaningful youth engagement important? And what should governments and other stakeholders do to ensure our meaningful engagement?
Yeah, thank you, Yoko. Yeah, as you actually one of the big demographics right now, and then we add in a lot of voice in our community. We always see that youth comes up with very innovative initiatives. However, what the thing here is that how do we actually get the spot on the table for our ideas? So I think that when we talk about climate justice, we ought to talk about human rights. It's very important to make sure that all of the stakeholders actually their opinion counted in this discussion. Example, in my case, like as a healthcare profession, it is our mission to ensure that everyone actually has access to the healthcare, to the medications, and the clean water, which means that when we talk about climate justice with youth, we want to make sure that we are actually fighting together for this healthcare rights and then together for the climate justice.
No, it was the last one. Audrey. Good? Okay, so the last question of our session for this panelist will be to Giulia. So Giulia, to the end, I heard that PMNCH and its partners are leading on organizing a global forum for adolescents in October 2023. And there is a youth-led campaign running for more services, policies, and funding targeted to young people. Can you tell us more about it?
Thank you, Yoko, for the question. So As mentioned before, climate change really disproportionately affects adolescents and young people. But we also know that young people are currently not prioritized in climate policy making, climate decision making, and also when we look at, specifically when we look at policies and financing. So, for example, between 2003 and 2015, only 1.6% of development assistance for health was really targeted to adolescents and young people. When we look at policies, for example, in relation to nationally determined contributions, we know that only 39% by UNICEF are considered as youth sensitive. So there is really a need for young people to join forces to not only demand for more ambitious climate action, but demand that adolescents and young people, children, adolescents, and young people are really put at the center of climate responses. PMNCH, the world's largest alliance for women, children, and adolescent health, and its partners are joining forces to convene a 1.8 billion campaign, which is called the 1.8 Young People for Change campaign. To tell you more about the campaign, we have prepared the video for you today. So I would now like the colleagues to kindly share the video.
As a young person, I need good and quality education and support from my parents and whoever is related to my school education.
Lo que quiero para mi bienestar ahora es un país seguro para mi familia, para mí, para mis seres queridos.
I need to have access to free sexual reproductive related services and the available youth-friendly healthy corners in our communities.
My dream in life is to have a successful career where I am in a position to help others and make change.
I think as young people, we don't want to stop. We really want to talk about our rights and our opinions, and to be able to get platforms where we can really voice our concerns is the biggest thing that can happen to us.
The 1.8 billion Young People campaign is hosting the Global Forum for Adolescents in October of 2023. This will be the biggest global gathering of and for young people.
We will have a 2-day virtual program to share, engage, and act.
From now until the Global Forum, we're bringing together the voices of young people from all over the world.
We are writing policies based on our views.
And we're taking our demands to local, national, and global decision makers.
We are sharing what works.
With more commitment now for adolescent well-being, we will succeed.
So let's all get involved
and make your voice heard.
And share what you want for your well-being by scanning the QR code to add your voice.
Be a part of the Global Forum for Adolescents.
Connect in your community.
Rise.
Unite.
Lead.
And as a few panelists, thank you. Sorry about that. So thank you, Giulia, for ending with the video. So the 1.8 people joined together to call for the forum of adolescents, and many partners have partnered with us. So this means that we are not left behind, but there's many different organizations who are supportive of us. And as some of the panelists have mentioned, that it's really important for all these youth to have access to basic needs. And we also have really to include all different dimensions of the health, like the sexual health as well. And there's also nature, and how like there's also the fossil fuel, the energy, it already have impact in our lives. And also, it's really important for us choosing a youth to be part of this health and climate initiatives and coalition, so that everyone is together to really raise our voice to United Nations and also to the global leaders of the world. And so it's also really important for all the participants to be part of us this discussion and to have a really intergenerational equity and also have human rights and everything interconnected. And thank you for everyone here and to bring us across the world to join this COP27, and also for those who are not here to be really part of this voice. And thank you again for to be part of our closing remarks. If any of the participants have final remarks, please speak so.
Yeah, I think a big thing about like youth engagement in climate change, as we can see a lot of youth having a lot of initiatives in the community. One big thing is not only about how to have more youth engagement. I think that there are quite a bit of youth engagement, but we do see a lot of like youth engagement in the youth community. So sometimes people kind of like describe us as being in the bubble because we are like having a lot of youth engagement. But I think the big question here is how to get other stakeholders and government inside our bubble as well, inside our community, to actually build the gap and then like have that bridge between us and then with the other stakeholders to actually make an impact. So I think this is moving forward. A lot more of those will need to be done to really like make all these like youth initiatives impactful.
Maybe Yoko, if I can just add on that. So in terms of the youth initiatives, Mohamed talked before about the Youth Climate and Health Network. So we just wanted to give a bit more information on that. So the Youth Climate and Health Network is being convened by the Global Climate and Health Alliance to really support and engage the young people from different sectors, health, climate, and other sectors, in the climate and health movement. And we are seeing the climate and health movement here in action these 2 weeks at COP27. We have done, as part of the founding committee with Mohamed and other amazing young leaders, we've done a landscape mapping and also through our own experiences. And what we've seen is that for young people who are engaged in the space of both climate and health, there was really a need for there to be a platform where we could meet, exchange ideas, and join forces more powerfully together to make our actions more impactful. And so the mission of the network is really for it to be a global platform of youth to drive action and advocacy for health and climate justice, provide capacity building on the intersection between climate and health to other young people, and really meaningfully engage young people, which is what Audrey and both Mohamed also mentioned before. So as part of the objectives of the platform, we want to really amplify the voices of youth, health, and climate organizations and individuals to really have more impact in national and international decision making for a green, healthy, and sustainable future. And then also support the exchange of skills, knowledge, and provide capacity building so that it's not only amongst young people themselves, but also broader within the climate and health movement to ensure that there is interaction also with the broader health professionals who are involved in this movement. As Mohamed said, we are currently putting together the network, and so if you have further questions or information that we may want to share, you can reach out to us after the session and to the GCHA colleagues who are here with us today as well. Thank you.
Can I just build on what Giulia said? I just want to thank the GCHA for doing this amazing work on. So I work in spaces which do not really have the health messages on board. I work in disaster risk reduction, I work in migration, and getting those health messages along with the other advocacy messages is really hard, because as you know, as when I was part of the health community, at least, there was always going to be the health messages. But when you go to all these other communities, not really. So what GCHA has done in trying to compile the health message of adaptation, mitigation, loss and damage in this scope and bring together the health community, I think that's pretty amazing, and they've contributed a lot to bringing the climate health message, at least at this COP.
Yes, so just maybe a very, very quick final remark from me. I would say since we're in COP, we need to make more use of this engagement and this opportunity that we're part of. The negotiating rooms, some of them are closed, but there are many rooms where parties are there speaking about their stances. We need to be there, we need to listen to them, and we need to speak to them about our goals, because they are the ones who are getting these final texts done. So we need to make sure that health and youth are there, not just on the agenda, but also on the text and on the commitment that they need to commit to. So please make use of these opportunities and try to engage meaningfully as much as possible. So yeah, thank you.
Thank you. So that is the final part of our session. And thank you for the applause from the participants as well. Yeah, thank you for joining us today. And we will be finishing the session.